A warning tonight for Ontario's lawmakers as they try to deal with the crisis of homelessness in the province. Medical experts say homeless people are turning to hospitals for help, contributing to crowded emergency rooms and the rising cost of health care. Al Sweeney is covering this story today and joins us live with the details. Al.
Emily, the doctors are telling us that hospital emergency departments are being used as warming centers by the homeless. It's one place they won't be turned away as other homeless people turn to desperate measures to stay warm. The couple in this tent say they've been living here for about 10 months. And Andrew and Jen say this is one thing people living in tents do to keep warm when the weather gets cold. They start a fire inside.
It'll probably burn for 15, 20 minutes, half hour. And that whole tent is toasty warm.
They admit it's very dangerous. They've already had one tent burned down.
It sucks. It does, it sucks.
And they say the fumes are dangerous, but they have to get through the winter. Other homeless people are looking for other ways to survive, turning to hospital emergency rooms. A medical group study says in the winter of 2022 to 2023, non-urgent visits to emergency rooms by homeless people trying to stay warm increased 27% across Ontario.
It just shows that when we don't have adequate shelter in the community, the emergency department ends up picking up the slack.
In Hamilton, St. Joseph's Healthcare President Mike Heenan says over the last year, St. Joe's saw nearly 4,000 emergency department visits from homeless people, a 43% increase from 2018. And unhoused patients face more complex challenges that require more hospital admissions than ever before. The head of Psychiatric Emergency Services says this has been a pressing issue for the hospital for years.
We are the sort of collection location for all of the struggles and failings of the social safety net.
Charlebois says the hospital is overwhelmed, but homeless people have nowhere else to go. And it's heartbreaking for the staff.
There's a powerlessness that we have when somebody's coming in saying, you know, this horrible thing is going on with me. And we're staffed and resourced and sort of trained and oriented towards dealing with acute medical issues, not with housing and food security and where you're going to get your medications next week.
And homelessness means more crowding in emergency wards and a higher cost of health care.
Homelessness is a problem that if we don't address it, it will, we're going to pay the price collectively, both in human suffering and in impact on our healthcare system.
And the doctors at St. Joseph's say staff there often face something they hate to do. That's discharging someone to no fixed address every hour or 90 minutes some nights.